If you're over 60 and sometimes live alone, listen closely. A sudden pressure in your chest, shortness of breath, a wave of nausea, cold sweat, your brain races, gas, anxiety, or my heart. In emergencies, seconds feel like hours. The first 1 to 3 minutes can shape the outcome. The heart doesn't wait for perfect circumstances. Many heart attacks happen at home, often at night, when no one is around. Most people freeze or minimize symptoms. Good news. We can replace fear with a simple plan. Today, we rewrite that plan. Calm, clear, step by step. Same helpful theme and flow, with U.S. medical guidance from Harvard, Mayo Clinic, NIH, Johns Hopkins, Cleveland Clinic, plus super practical habits you can set up this afternoon. Goal: turn knowledge into reflexes. Heart attack, usually a blocked artery. You're often awake, chest tightness, short breath, sweating. Pain that may spread to arm, jaw, back. Cardiac arrest, electrical failure. You collapse and lose consciousness within seconds. Our steps can buy time in a heart attack. Nothing replaces 911 in medical care. If you collapse or can't stay conscious, 911 plus CPR or AED, here's our roadmap. Emergency communication system. The truth about cough CPR, aspirin, used properly. Safe body position. Controlled breathing. Unlock and signal. Nitroglycerin, only if prescribed. I'll speak like I would to my parents. Warm, straightforward, no scare tactics. No jargon, only what your hands can do. We'll add simple home prep. Cards by the phone, door, lights, lockbox, small whistle. 10 minutes now can save precious minutes later. In the U.S., hundreds of thousands face heart attacks and out-of-hospital cardiac arrests each year. Many happen at home. Early recognition. Call 911. Follow dispatcher instructions. These raise survival and reduce damage. Our job: make the first minute automatic. Not everyone feels an elephant on the chest. In older adults and women, signs may be quieter. Tightness, shortness of breath, unusual fatigue, dizziness, cold sweat. Pain may spread to arm, jaw, back, or upper stomach. If your gut says, "This isn't normal for me," treat it as cardiac until a clinician says otherwise. Better a harmless mistake than a dangerous delay. Call the first minute your steady minute. Your goal isn't to be a hero. Your goal is to call, clear the way, and place your body safely while help is on the way. Say it softly. I don't need to do everything. I just need to do the next right thing. Tip 7. Emergency communication system. Phone nearby is not enough. Low oxygen can blur memory and coordination. Designed for shaky hands and fuzzy recall. Index card, 2 minutes. Write in bold on a bright card. Full address with unit, gate, elevator details. Best callback number and a backup. Key medical facts. Aspirin allergy, blood thinners, heart history. Emergency contact. Tape it by your bed, main phone, and inside the front door. Phone setup. iPhone medical ID or Android safety and emergency. Enable emergency SOS. Put 911 and ICE on top of favorites. If you use a smartwatch, enable fall detection and rhythm alerts. Night routine. Phone on the nightstand, volume on, charging. If you live alone, use a waterproof medical alert you'll actually wear, even in the shower or during naps. Prefer models with fall detection and GPS neighbors and access. Give a spare key to someone you trust. Or install a lockbox and share the code. In apartments, tell the front desk that EMS may need entry. Practice a 20-second drill. Calling 911. My address is, I'm alone, door unlocked. Do not drive yourself to the ER. Do not wait and see. Call early. Tip 6. The truth about cough CPR. In hospitals, with monitors, brief coached coughing may help certain arrhythmias for seconds. At home for the public, it is not recommended. You can't diagnose your rhythm. Coughing can delay life-saving steps. Do this instead. Call 911 on speaker. Unlock the door and turn on lights. Sit semi-reclined and use controlled breathing. Follow the dispatcher. Controlled diaphragmatic breathing. Inhale through the nose for 4. Hold for 4 if comfortable. Exhale through pursed lips for 6 to 8. Repeat for 1 to 2 minutes while giving information. Long exhalations activate the body's brake, reduce panic, improve efficiency. If faintness rises, lower to the side in recovery position. If someone arrives, start hands-only CPR and use an AED if available. Tip 5. Aspirin. Quick and safe use. First, call 911. Describe briefly. Chest pressure, short of breath, sweaty, alone. Ask, should I take aspirin now? If advised and appropriate, chew 325 mg or chew 481 ml tablets. Chewing works faster than swallowing. Even if enteric-coated, still chew. Do not take aspirin if allergic. Do not take if actively bleeding or recently had GI bleeding. Do not take for suspected stroke. Face droop, one-sided weakness, slurred speech, thunderclap headache. If you use blood thinners, follow your clinician's written plan. Keep aspirin truly ready. Nightstand. Kitchen drawer. Wallet or purse. Label the cap. Chew 325 ml plus 911. Check dates every 6 months. Tip 4. The safe position while you wait. Sit back at 30 to 45 degrees. Knees bent, feet supported. Loosen tight clothing. Stay indoors. Crack a window. Avoid heat. Why it works. Easier breathing, smoother blood return, lower workload. Avoid lying flat unless you're about to faint. Do not pace around. If faintness rises, lower to the floor on your side. Keep the phone on speaker. Tip 3. Controlled breathing. The calm switch. Soft belly inhale for 4, hold for 4 if it feels okay. Long, slow exhale for 6 to 8. Do 6 to 10 cycles as you talk to 911. Tip 2. Unlock and signal. Tell dispatch, I'm unlocking my front door now. Please stay with me. Leave slightly ajar if safe. Turn on all lights so your address shines. Apartment living. Give gate code, elevator, and unit info from your card. Call front desk or security to escort EMS. Tape an emergency info sheet inside the front door and on the fridge. Name, date of birth, meds, allergies, conditions, doctor, emergency contact. Tip 1. Nitroglycerin, only if prescribed. Call 911 first. Tell them you have nitroglycerin. Sit down, never standing. If eligible and advised, chew aspirin first. Then nitro under the tongue, 0.3 to 0.4 mg tablet or 0.4 mg spray. Set a 5-minute timer. No relief? Dose 2. Still no relief after 5 minutes? Dose 3. Maximum 3 doses in 15 minutes. If woozy, stop dosing. Tell dispatch. Lie on your side. Hard stop. No nitro within 24 hours of sildenafil or vardenafil. No nitro within 48 hours of tadalafil. Store tablets in the original amber glass bottle. Replace every 6 months. 60-second recap. The steady minute. Call 911 on speaker. Say your address and symptoms. Stay on the line. Unlock and lights on. Sit 30 to 45 degrees and breathe 4 to 4-6. Aspirin chewed if advised and appropriate. Nitro only if prescribed. Under tongue up to 3 doses, 5 minutes apart. If faintness rises, recovery position. Keep talking. Practice now. Index card taped. Aspirin labeled and reachable with eyes closed. Lockbox and porch light checked. You can't stop aging, but you can slow it, and you can steer it. Preparation turns fear into action. Which step will you set up today? Index card? Lockbox? Aspirin label? Medical ID? Porch light? Comment your age and city so we can tailor future tips. Subscribe for trusted science-backed guidance after 60. Share this with someone who lives alone. It might quietly save a life. 5-minute caregiver. Neighbor briefing talk for 30 seconds with the support person. If I am clutching my chest or having difficulty breathing, do not drive me. Call 911 on speakerphone. Read the address from the card. Unlock the doors and turn on the lights. Have me sit with my back tilted 30-45 degrees. Help me breathe slowly. If the operator allows it and I am fit, give me 325 mg of aspirin to chew. If the doctor has prescribed nitroglycerin, place it under the tongue while sitting. Maximum of 3 doses, 5 minutes apart. If I faint, start chest compressions using only hands. Use an AED if one is nearby. Supporter script page on the fridge. Call 911 on speakerphone. Say chest pain or difficulty breathing. 72 years old. Home alone. Address is Reads card. Approach. Open door slightly. Turn on lights. Apartment. Come out to greet or call security. Position. Sit with your back straight. Knees bent. Loosen your belt and collar. Breathing. Instructions. Inhale for 4. Hold for 4. Exhale for 6 to 8. Count aloud with them. Aspirin if appropriate and recommended. Chew 325 mg or 481 mg tablets. Do not use if stroke is suspected, allergic, or bleeding is active. Nitro only by prescription. Place under tongue. Sit timer for 5 minutes. May repeat up to 3 times. Stop if dizziness occurs. If collapsed, begin chest compressions using only your hands. Push hard and fast in the center of the chest 100-120 times per minute. To the beat of Staying Alive, allow the chest to fully recoil. Send someone to get an AED if the building has one. Note to the dispatcher: don't argue. Don't drive yourself. Don't give water if you feel nauseous. Your calm voice and counting rhythm will be your medicine while you wait for EMS access and display checklist apartment or condominium, receptionist or security. Allow them to lead EMS to the apartment. Confirm after-hours procedures, elevator or magnetic card. Clearly write the elevator number and card usage instructions on the door card and refrigerator label. Apartment identification. Bright ribbon on doorknob during the day. Light under door at night. Door slightly ajar for safety. Neighbors. Choose one person on each side. Share the box key and support script. AED location. Ask the management. Usually in the lobby, gym, pool. Write on the refrigerator: where is the AED? Private house or townhouse. House numbers. Upgrade to 4-6 inches high. Reflective. Contrasting color. Illuminated if possible. Visible from the street, porches and entryways. Replace broken light bulbs. Keep walkways clear. If you call 911, turn on all porch lights. Lockbox. Install a realtor-style lockbox at chest level. Practice opening it. If it's electronic, change the batteries annually. Gates and side doors. Write the gate code on the instruction card for EMS to use. Do not open side doors unless instructed to call 911. Street signs. If you have trouble finding your home, tell the operator. Blue pickup truck in front of the house. Porch lights on. Basic AED knowledge. An AED is a simple device that analyzes the heart rhythm. Gives a shock only when needed. Step-by-step voice guidance is provided. Find AEDs in apartment lobbies, gyms, swimming pools, senior centers, churches, shopping malls, airports, community halls. How to use in 30 seconds. Turn on the AED. Expose the chest. Apply the patch as shown. Stop chest compressions when the AED says it is analyzing. If the shock-advised message appears, press the shock button. Then return to chest compressions as soon as prompted. Follow the voice prompts until EMS arrives. Empower your support person. Ask your fire department or senior center about a free CPR AED class. A 60-minute class is enough to boost confidence. Personalized guidance medications and underlying diseases. Aspirin allergy or bleeding risk, yes or no. Anticoagulants, name, dose, time of use. Nitroglycerin, yes or no, form and dose. Date of bottle change. ED medications, Viagra or Levitra within 24 hours. Cialis within 48 hours. Yes or no. Other heart medications. Beta blocker, ACE or ARB, statin. History, stent, bypass surgery, atrial fibrillation, heart failure. Treating physician and phone number. Your typical symptom pattern. Chest sensation, pressure, tightness, burning, aching, indigestion-like. Radiation, left arm, jaw, back, epigastric. Accompanied by shortness of breath, sweating, nausea, unusual fatigue, dizziness. Sample 911 phrase: I am age, have underlying condition. Chest pain and shortness of breath. Minutes. Address red card. I am alone. The door is open. CPR AED facts around the house. Where's the nearest AED? Who knows CPR near you? Dates you will attend a free CPR class. Barriers and solutions. Forgetting to leave phone on bedside table. Extra $10 charger and reminder. Fear of freezing. Practice steady minute twice. Teach a neighbor. House number too small. Order 6-inch reflective numbers. Install this weekend. What if? Situation: if symptoms wake you in the middle of the night. Sit up. Turn on the light. Call 911 on speakerphone. Exhale slowly. Open the door. Turn on the light. Chew aspirin if appropriate and recommended. Nitrous oxide if prescribed, while sitting. Don't go out alone. If pain subsides after 10 minutes, do not cancel EMS. Pain relief can still be dangerous. Notify dispatch of the change and await evaluation. If cognitive impairment, Place a blue sticker on the light switch. Call 911 speaker. Use a picture on the refrigerator, phone, door, chair, breathing. Wear a simple medical tag on a lanyard. If you don't have aspirin on hand, don't go looking all over the house. Sit still, keep breathing, listen to the operator's instructions. Add it to your nightstand tomorrow. The two-phone advantage. If two people have phones, one keeps 911 on speaker, the other opens the door or calls security. Label the phone, dispatch and door during practice to avoid accidentally hanging up. Dignity and composure. Say it out loud. I can be scared and still do the next right thing. This unlocks action. The brain chooses the step over the story. Your plan isn't complicated. It's sequential. You've turned the scary what if into a clear plan. Keep the card on the fridge. Practice the steady minute. If this add-on is helpful, save the video and send it to your building manager or senior center. They can print out fridge stickers for everyone. Prepare quietly but save loudly. Instructions for talking to your doctor. Goal. Have a written plan that fits your medical history and medications. Risk profile. I am age, have hypertension, hyperlipidemia, diabetes, atrial fibrillation, family history. Last 3 blood pressure readings, morning and evening. I live alone or with relatives. I am usually alone or have someone to look after me at night. Emergency instructions should include: should I chew aspirin for chest pain or shortness of breath? Are there any contraindications? Should I be prescribed nitroglycerin? What is the dose, when, and maximum? Do I take ED medications? Write down the time of the inability to combine. If I am taking blood thinners, what is my emergency aspirin plan? Please write it down. Personal red flags. What symptom patterns warrant calling 911 immediately? What symptoms are atypical for my age and gender? Monitoring and prevention. Am I eligible for cardiac rehabilitation or a supervised walking program? Would you like me to take my blood pressure at home 1 week a month and send in a diary? What tests or vaccines should I have to support my heart? Request 1-page printout, yes/no aspirin. Nitrogen guide. Drug interactions. Place on refrigerator sheet. Security upgrade in an afternoon lighting and house numbers. Change to bright LED bulbs. Add a sensor light from the bed to the door. Attach a 4 to 6 inch contrasting color, reflective house number that is visible from the street. Lock and access. Install a realtor lockbox at chest level. Test the code with a neighbor. Hang a wire door wedge from the doorknob to open the door easily. Information placement. Inside door. Eye-level emergency information leaflet. Refrigerator, copy plus medication list. Keep pen handy for updates. Nightstand, plain aspirin. Label, chew 325 mg or pull a 911. Nitro if prescribed. Whistle. Glasses, water, phone charger. Address tag on nightlight. 5-minute obstacle clearance. Remove slippery rugs or tape down edges. Coil up electrical cords. Clear a path from the couch or bed to the front door. Day heart-friendly lifestyle. Daily anchor. 10-20-minute walk after largest meal. 2 rounds of 4-4-6 breathing before bed. Daily plan. Monday, legs and walking. Heel raises hold for 3 seconds, 2-3 sets of 8 to 12. Sit stand slow lower for 3 seconds, 2-3 sets of 6-10. Walk after dinner for 10-20 minutes. Tuesday, balance and walking. Knee raises with hands and knees 2-6 to 8 each side. Lineups 20-30 seconds. Walk 10-20 minutes. Wednesday, legs and walk. Repeat Monday or add 2 4-centimeter step down 2-6 to 8 each side. Walk 10 to 20 minutes. Thursday, flexibility and sleep. 10 ankle rolls in each direction. 2 20-second calf stretches per side. 6 chest openers per side. 10 20-minute walk. Early, light dinner. 2 rounds of 4-4-6 breathing in bed. Friday, legs and walking. Heel raises. Sit and stand slowly. Step down low. Walk 10-20 minutes is Saturday, food and friends. Go to the market. Add a colorful plant and a low-sodium dish. Make a quick call to a friend. Go for a walk, Sunday, review and reset. Check aspirin and nitrous oxide locations. Check refrigerator shelf. Do a steady minute. Go for a light 10-15-minute walk. Safety note. If you experience chest pain, unusual shortness of breath, or lightheadedness while exercising, stop. Breathe in for 4. Hold for 4. Breathe out for 6 to 8. If this doesn't help, follow your emergency plan. 2 quick print wallet cards, emergency hint card. Call 911 on speakerphone. Address. Open door and turn on lights. Sit 30-45 degrees, knees bent. Breathe 4-4-6, long exhale. Aspirin if recommended. Chew 325 milliliters. Do not use if stroke, bleeding, or allergic reaction is suspected. Nitro if prescribed. Sublingual, sitting, timer 5 minutes, maximum 3 and 15 minutes. Do not use with ED medications. If faint, recovery position. Hold the phone, medicine card, and contact. Medication name and dose. Allergies, underlying medical conditions. Doctor and phone number. Emergency contact person. Lockbox code. 3 small changes for the heart switch up the salt. Choose a low sodium version. Rinse canned beans. Your tongue will get used to it in 2 to 3 weeks. Swap fats. Replace butter 1 serving a day with olive oil or avocado. Switch up your fiber. Add one of the following each day. Half a cup of oatmeal. Half a cup of beans or lentils. A handful of strawberries or an orange. Calm reset 60 seconds sit. Feet on the floor, lean back. Hands on your belly. Inhale for 4. Hold for 2 to 3. Exhale for 6 to 8. Whisper. Exhale long. Lower your shoulders as you exhale. Repeat for 5-6 counts. Common obstacles and how to handle them. Leave your phone in the living room. Keep a power bank by your bed. Put a note on your bedroom door. Family member panics easily. Practice your support person script once this week. Count your breaths aloud. You lead the pace. Don't like to think about emergencies. Change the frame. Being prepared is being kind to your future self. Do something small. Hang a tag or install a lockbox. Reward yourself with a short walk in the sun. Quick summary call ahead. Turn on and off lights. Position and breathe. Chewable aspirin if appropriate and recommended. Not for stroke symptoms. Nitro only by prescription. Take sitting up. Maximum of 3 doses in 15 minutes. Do not combine with ED medications. Do steady minute twice this week. Fill out refrigerator and wallet cards. You've done what many people don't. The heart loves clarity, oxygen, and a steady rhythm. With a few cards, some light, and a few minutes of movement each day, you've turned your what-if fears into a plan you can live with. If this series helps you feel more confident, please subscribe to the channel and share it with someone who stays home at night. Sharing a plan saves a life.